So I did a Q&A the other day and someone asked me if I had done a C-hist before, and I replied saying that I did 5 C-hists in residency and about 3 since I've been in attending. I got so many DMs about what is a C-hist. C-hist stands for a cesarean hysterectomy, and essentially this means doing a hysterectomy at the time of C-section. Hysterectomy means removing the uterus. This is not recommended to do. It is not a safe situation, and it usually is pretty emergent and not planned. Are situations where it is planned, and I'll get into that, but it's usually done as a life-saving measure. Yes, I've had patients ask me if they can just get a hysterectomy at the time of a C-section to save them a surgery because they don't want any more kids, they don't want any more periods, blah, blah, blah. But it is never okay just to willy-nilly do a hysterectomy at the time of C-section. Mainly, this is because during pregnancy, the uterus is very, very, very hypervascular, meaning it's going to lead to a lot of blood loss. Vessels are swollen, tissue is swollen, everything's very edematous, and it makes surgery very difficult, and it makes the risk of the surgery, meaning more likely to cause complications, infections, blood loss, injury to any of the surrounding organs, the bladder, the ureter, like it makes the risks significantly increased. And you may not always guarantee that you're going to be able to remove the cervix at the time of a cesarean hysterectomy. So then that person may still need lifelong pap smears. They still actually may even get periods after a C-hyst if you don't successfully remove all of the tissue, which I've seen happen. During residency, I had a patient that had a percreta, meaning her placenta was growing through the uterus to the serosa of the uterus, and then there were thoughts that it was growing into her bladder. The thought of thinking of that patient again makes me nauseous. She was a planned and scheduled cesarean hysterectomy. She was actually put to sleep. There were several teams around when we did the surgery. There were gynocs, urogyn, general surgery. We were all like, if you could see the OR, there were so many people there. It was scheduled early, so we had to do it preterm. She got so many blood products. She was in the ICU afterward. It was just a mess of a surgery. Other times in my career that I have done a cesarean hysterectomy was because of postpartum hemorrhage, meaning we tried everything in our toolkit, everything in our arsenal to try and get this patient to stop bleeding. And it got to the point that if we just didn't remove the uterus, she could have died. A C-hyst. Not great. Hopefully you never find yourself or a family member in that situation. Some may say I have a black cloud because of it, but I like to think of it now I'm prepared if I need to do it.